Individual differences within groups of males and females are generally greater versus between the sexes. Other gender characteristics include interaction of genetics and environment, brain structure and brain functioning in males and females, affective responses, cognitive processing, and gender-related cognitive abilities, such as general intelligence, verbal ability, mathematical ability, spatial ability, problem solving, and school achievement. And here are how males and females differ from each other but are still the same human beings.
My brains are larger than hers.
That's okay because I have more neurons than him.
Girls speak more clearly, read earlier, and do consistently better on tests of spelling and grammar than boys. Let's hear her read.
It says, let there be light, and there was light. God saw that the light was good, and he separated light from the darkness. God called the light day, and the darkness he called night. And there was evening, and there was morning, the first day.
By the end of elementary school, however, boys show signs of excelling in mathematical reasoning. Without exception, girls get better grades on average than boys, particularly at the elementary school level. Scholastic performance of girls is more stable and less fluctuating than that of boys. Females are more likely to express achievement, motivation, and social skills and social relations, whereas men are more likely to try to succeed in intellectual or competitive activities, like these boys playing competitively in basketball. This difference is thought to be due to sex role expectations that are strongly communicated at very early ages. These are the gender-related personality behaviors, which also include aggression, conformity and dependence, emotional adjustment, values and life goals, achievement orientation, gender gap, and gender bias. Gender equality is when people of all genders have equal rights, responsibilities, and opportunities, just like this group of friends.
Bakla ko.
Okay lang yun. Matagal na namin alam dati pa. Ako din guys, may sasabihin sa inyo.
Ano yun?
Nagkakagusto ako sa babae.
Okay lang yun.
Mahal pa rin namin kayo.
Ang mahalaga, mahal natin ang isa't isa.
A good teaching method in a variety of genders must include: number 1, create an environment welcoming to all men and women. Secondly, avoid making assumptions about family structure, sexual preference, or lifestyle. And lastly, adjust admission or intake forms to be more inclusive. Socioeconomic status is the most important determinant of physical and mental health in our society. Socioeconomic variables such as educational level, family income, occupation, and family structure affect health beliefs, health practices, and readiness to learn. Low education levels results in occupations with lower levels of pay, prestige, and intellectual demand. This does not allow one to easily change a pattern of life. Lack of financial sources has a negative impact on prevention of illness, compliance with treatment, and motivation to learn.
Amam himsir hospital bill.
The cost of medical
100,000?
care and supplies can negatively impact a person's or family's financial well-being, especially if socioeconomic level is already low. The good thing is that PhilHealth
Okay lang yun,
helps.
ma'am, kasi sagot na yan lahat ng PhilHealth.
Occupation of parents, income of family, location of residence, and educational level of parents are the types of indices for the measurement of social class.
General assessment and teaching interventions is all about understanding every beliefs, opinions, and traditions in every culture and how it works for us all in general. See, we all have different understanding when it comes to health. That's why according to the book, the role of educator must implement successful teaching interventions using universal skills and also active listening to assess the problem. Because you are not only teaching and assessing a specific group of people. Also, it requires an active listening skills in order for you to guide, help, and accept the client's explanation in a non-judgmental manner. According to the book, assessment should attempt to determine health beliefs, values, and practices. That's because some of us have traditions that they need to follow, like ethnic groups. A culture has a great influence on health problems and understands what their ways of treatments. That is why assessment is very important to plan an action for some behavioral change. For example, there are some cultures that believe that if a person shows no symptoms of illness, then he or she is not ill. Now, we all know that there are some diseases that are asymptomatic or shows no symptoms. That belief could be a problem and can cause multiple deaths. I have a scenario here. There's been an accident where the motorcycle rider crashed and is badly wounded. Let's say his life is at death's door. The rider was brought to the hospital and the doctor decided to do mercy killing since the patient has no chance of living, just to end his painful suffering. And the fast forward, and the doctor did what's best with the family's consent. Now, some people would not understood what the doctor did. Most of the people will say he or she would have treated the rider without knowing that it's what's best for him. That's why in general, we must be ready to learn and to be assessed. According to Sir Anderson, 1987, specific guidelines for assessment should be used regardless of the particular cultural orientation of the client. Number 1, observe the interactions between patient and family members and among family members. You should know who is the decision maker and what is important to the patients and family. That includes how they want you to treat their patient. Number 2, listen to the patient. Listening to the patient is a good way of communication. You will know what the patient wants. 3, consider communication skills and patterns. Sometimes, non-verbal behavior they do are normal for them, but in another way can offend you. Choose to understand the situation. 4, explore customs or taboos. Explore and ask with restrictions. You may ask too much that can offend them. There may be a provision to the treatment with regards to social or their religious custom of their family. 5, determine the notion of time. Be aware of the patient and its family's special time. And lastly, number 6, be aware of cues for interaction. Determine when to approach and how to approach with respect. That way you can comfortably address a person with comfort, security. These guidelines will help you become effective not only as a healthcare worker but also a teacher.
Guidelines for assessment.
Assessment is a component of the teaching process that attempts to determine health, beliefs, values, and practices to understand problems and establish reform.
How are we sure that the assessments are used correctly regardless of the cultural orientation?
Well, we know more because it is easily attainable by respecting each other's cultural differences and by following the specific guidelines for assessment. First, determine who makes the decisions, how decisions are made, who is the primary caregiver, what type of care is given, and what foods and other objects are important to the patient and family. Find out what the patient wants, how the patient's wants differ from what the family wants, and they differ from what you think is appropriate. Be aware of nonverbal behaviors and etiquettes of interaction that may be acceptable or unacceptable to the patient and family. The patient's primary language, which may be different from your own, and manners of speaking like rate of speech, expressions used that can enhance or hinder the understanding. Observe behaviors and ask to clarify beliefs and practices that may restrict care or treatment. Become oriented to the patient's and family's sense of time and importance of time frames. Determine which approaches are appropriate for patients and families with respect to how to comfortably address the person with whom you are interacting and the symbolic objects or the activities that provide comfort and security. Preparing nurses for diversity care. Delivering the appropriate healthcare today and in the future will depend on use of a culturally informed approach that goes beyond simple language translation and an understanding of the characteristics of different cultures. The nursing profession must be prepared to establish a new paradigm for creating and managing diversity within our workforce, as well as within a new healthcare marketplace consisting of consumers and staff from multicultural backgrounds. Diversity has the potential to positively affect our profession by increasing organizational effectiveness, creating greater access to care, lifting morale of patients and staff, and enhancing productivity in the workforce. In this new century, our goal is to increase minority representation in nursing. We need to recruit and retain more minority students and faculty to expand diversity within us. The nursing workforce comprises less than 10% of people from minority groups, whereas more than 28% of the total U.S. population belongs to a variety of cultural subgroups. Innovative nursing education means incorporating social values that recognize diverse lifestyles and acknowledge multicultural and multiracial perspectives. As Straher points out, nurses must not only better understand the cultural characteristics and traits of patients and families from different ethnic backgrounds, but also improve the relationship between nurses and clients from different cultural backgrounds. Straher aptly states that transcending cultural differences is more than an appreciation of cultural diversity. It is transcending one's own investment in a social and economic system as one knows it and lives it. As caregivers, we must learn how to relate to people, both patients and fellow healthcare practitioners, from a variety of cultural backgrounds and discover the cultural meaning of various health events.
There were hundreds of subgroups in the US and many more worldwide. The following is a review of the beliefs and health practices of the four major cultural groups: Hispanics, Blacks, Asian Pacific Islanders, and American Indians. In this matter, medical technologists must be aware of clients' customs, beliefs, and lifestyles and be willing to take the responsibility for making adaptations in the institutional environment. The term Hispanic is used to label this heterogeneous group of Americans with varied backgrounds in culture and heritage. They are disproportionately affected by certain cancers, alcoholism, drug abuse, obesity, hypertension, diabetes, adolescent, pregnancy, dental disease, and HIV/AIDS. Health beliefs and practices stress exotic folklore practices such as herbs, teas, home remedies, and over-the-counter drugs. These things are for treating symptoms of acute and chronic illnesses. Diseases of hot and cold believed to be due to an imbalanced intake of foods or ingestion of foods. Cold air was thought to lead to joint pain and a cold womb, while heating or chilling was the cure for parts of the body afflicted by disease. Dislocation of internal organs used by massage or physical manipulation of the body. Magical origin caused by mal ojo or evil eye, a disorder of infants and children as a result of a woman's looking admiringly at someone else's child without touching the child, resulting in crying, fitful sleep, diarrhea, vomiting, and fever. Sosto, disease of emotional origin attributed to sudden or prolonged terror. Teaching strategies includes proved to be successful if cultural beliefs were observed. Educator was first introduced by an individual accepted and respected by the learners, if family members were included, and community was encouraged to take responsibility for resolving the health problems disease. The cultural origins and heritage of Black Americans are quite diverse. The roots mainly from Africa and Caribbean islands. The increase of exposure to hazardous working constitutions has resulted in a greater incidence of occupation-related diseases and illnesses. Another major problem. Foods to them symbolizes health and wealth. So a higher than ideal body weight is viewed as positive by this ethnic group. Black Americans' belief system emphasizes three major themes. The world is a hostile and dangerous place to live. The individual is vulnerable to attack from external forces. And the individual is considered helpless with few internal resources to combat adversity. Black people often have strong religious values, and these religious beliefs may extend to their feelings about illness and health. Folk practice called voodoo. It consists of beliefs about spirits inhabiting the world. All animate and inanimate objects have good or evil spirits. A religious priest with doctor medicine man has the power to appease or release hostile spirits. In the decades following political and social upheavals in Southeast Asia, almost 750,000 people of Asian Pacific Islander origin immigrated into the United States. The medical system of this cultural group needs to be understood to successfully deal with their health issues. Buddhism, Confucianism, Taoism, and V. A fundamental belief is that all existence is suffering. According to the Buddhist philosophy, no humans are limited to a single existence terminating in death. Confucianism has a concept of the moral personality that is focused. Taoism has its roots in the two opposing magical forces in nature, the yin, negative, and the yang, positive. The idea of a good health depends on the balance between hot and cold. Fi is a belief in the spirits of dead relatives or the spirits of animals in nature. Belief that if a bad Fi happens in the atmosphere, it can result in illness or death. Offerings are made and special rites are performed to rid the person of a bad Fi. The current challenge to healthcare practitioners is to integrate Western medicine with traditional non-Western tribal folk medicine to provide cross-cultural health education to Native Americans in reservation-based communities across the nation. When someone's ill, witchcraft is still performed by some tribes. Some beliefs require incorporating the medicine of man into the system of care given to patients.
Let's take a look at my brother here, Jeremy Lin, basketball's favorite underdog story. His story celebrates his accomplishments through the lens of his cultural roots. That didn't really happen to any of the other famous basketball players, did it? Now, it may seem charitable to promote Jeremy Lin's heritage as the key to his success, thus extending praise of Lin to the entire Asian community. This story has a dark side to it. Asians are often thought as the model minority in places such as New Zealand. Smart, hardworking, obedient, and humble. But all these positive stereotypes have been invoked to explain his success on court. His intelligence is frequently noted, and you'd get people like on ESPN's Hubie Brown talking about some sort of high basketball IQ or something like that.
Hey, what you doing?
Oh, just getting a bunch of meds ready for my patients. I've got a bunch of patients right now, lots to do. Are you really busy right now?
No, I just got back from break.
I was wondering then, if you're not too busy, if you could just go check. There's a patient that's been waiting out in the emergency waiting room for a little while there. If you could just go check on her, that would be great.
Yeah, sure.
All right, thank you.
Hello.
Hi.
What's your name?
Last name's Davidson.
Davidson?
Yeah, Angie.
Angie Davidson? How are you doing? Are you okay?
I'm not doing very well. I'm really dizzy right now. And I'm really having difficulties just focusing on things and walking and just getting here. And I've been really sick the last few days.
Oh.
I've been throwing up a lot, and I'm so thirsty. I'm so confused right now.
Okay. Do you live alone? Is there anybody at home I can call?
No. I live on the street, so there's no one to call. But I came here on my own. And,
Yeah. Okay, I'll be back.
Thank you. Hurry. Hey, how's it going?
Hey, good?
Yeah?
Yeah.
I'm just wondering, that patient out in the emergency area, did you check on them earlier?
Oh, yeah. I did.
Okay. I was just out there, and they don't look like they're doing so well.
Yeah, they're homeless and they're just drunk, honestly.
Have they seen anyone yet?
Yeah, I went out there and I said hi to her. She just looks typical. She's just drunk.
Okay. Because in your patient's chart, if you looked in the chart, you would realize that your patient's a diabetic out there.
Oh, I didn't know that.
So you can provide better treatment for your patients. It is critical for healthcare professionals to understand how stereotypes can impact their practice. Even small implicit biases can have large consequences for patients and can lead to life or death situations.